on this live, and this is something that has been on my mind to talk about. I don't know if you guys are aware. Well, most people who go to uh, moderately sized hospitals are aware, I believe, or even those who go to simple healthcare centers know what I want to talk about. And for those who may have left the shores of Nigeria now and then, you know what healthcare services are like in other countries, even in small countries like Ghana, just close to us. But it beats my imagination to think, you know, that a place like our own country, Nigeria, totally refuses to grow, you know, or take on some of the supposed things many of our people claim they have been exposed to. The banking sector is a no-go area. Many of such bank executives travel outside the shores of Nigeria, and who would obtain, you know, likewise in the healthcare sector, most of them claim they are doctors and nurses, many of them even leaving our shores. So why can't people like this who have been exposed to nice, good things that can impact our people not tell their friends about it? I mean, their colleagues who are still back home practicing medicine. You know, those days we used to hear or tell stories about nurses who nag and talk to patients anyhow. And most of them are still in our hospitals today. Why can't they ever want to live up to expectation or be healthcare personnel that are supposed to be people who care for people, you know, want them to be healed, you know, taken care of health-wise, where you find that many of them do not even let people talk. I'll give an instance of this whole situation or scenario I'm trying to create here. It's not about talking down on a nation. If you want to hear people who talk down on Nigeria, go to our social media platforms to hear about the Japa people, people who just leave the shores of Nigeria and tell many stories about how you have been in Nigeria forever, nothing happened, but only living in Nigeria for 6 months and life has changed. There is water, there is road, there is this. Please, can you help me ask them if all those things they are mentioning are not paid for? They sound as if the government makes all of these things free. They pay for the water now. They pay for electricity. Their own electricity pay. Maybe this one will they do it, they will say, and they will cut light, people will go and join it together and blah blah blah. Once they cut your own, they have cut it. You have to go back through a long process to get it back in order. Is it the gas they use in cooking? It comes from a particular source. Once you don't pay, you switch off your own corner. You know, good roads. You talk about good roads. You didn't know the taxpayers' money that they use in building roads in America, Europe, and Canada. And people sound as if, oh, here is this, here is that. It's about your money now, your kudi, your ego, your owo that talks. And it's so funny or painful that many of these are our people who talk stories. I give God glory that I have gone to experience with my own eyes and seen and even went through the same stress that our people who boast and boast and boast. It's not even too good with them. You pay rent, you pay car insurance, you pay health insurance, you pay for all the utilities. Children's school fees are there. If you see the kind of jalopy cars our people drive back there, you will laugh. You will not even, somebody say, come, let me give you a ride. You will run away. Some of them drive rickety cars that people have thrown or dumped. You know, they claim that they just drive them to work. Some don't even wash those said cars. If you enter their car, you run or run away. These are the people who come and boast to us on social media. Hey, America, Canada, Europe, blah, blah, blah. Forget those people. Story for another day. And I'm going to talk about that story actually. Let's come back to where we are. Anomalies of healthcare in Nigeria is becoming a bane. A bane is a situation that is escalating and degenerating. What shall we do about our healthcare anomalies? Anomalies are bad situations that we don't even want to hear about. You know, we all know the major one. For starters, you go to a hospital, somebody needs care immediately, say emergency. You manage to even give them half of the money and say start treatment. No way. Nothing is going to happen. In which part of the world do people say you must pay? Okay, assuming the operation or whatever process or procedure they want to do in the US, for example, they said it's going to take $1 million. Do they ask you for $1 million before they start treating the people? No. You have certain things you can bring as collateral if that boils down to that worst situation. But if the family is able to raise part of the payment, then treatment must commence. It's high time hospital executives should be arrested. Because many times people die as a result of that situation. Treat somebody, you say no, they have to pay everything. No, that is the worst anomaly ever. Ever. I was at the hospital 2 weeks ago. The man brought his mom who had serious bone issues, and it had even degenerated to an infection in his mom's knee. You know, he talks with the doctor. The doctor says, talk to the people out there. First of all, they had told him the amount, and he knew he couldn't afford it at that point in time. So he wanted to take a picture of the diagnosis, which is something that is done or given to a patient. Once you go to any hospital in the US, Europe, or wherever, as soon as a doctor is done seeing you, they're going to give you like almost 5 or 6 sheets of paper stapled together. From when you stepped into the hospital, all of your medical readings are there. Your BP, your height, this, that. The first page. The second page will contain what the doctor has said to you that your problem is. The third page, they could put medicine. The fourth page, advice and some things you're supposed to be doing to aid your situation. They could even go on to talk about diet, and they will hand it over to you after you see a doctor. But in this part of the world, it's a no-no. It practically prevents patients from having access to their health information. Patients have the right to their health information. You don't have to keep it away from them. After all, the patient got a card, paid money to see a doctor. So they have the right to what a doctor has said. Imagine that the guy even forgot the name of what the doctor said his mom was suffering from. Because they refused to give him the paper, they would not let him take a picture of that page. He came in and was asking the doctor, okay, what is even the name of the sickness he said my mom has? It was embarrassing for me, really. Not on behalf of the guy, but because these people refused. And the doctor, a new doctor who was just 3 weeks old at that clinic, said she is aware that patients can get their medical records after each visit. So she said, go and tell them to give you. They refused. They came back and said they refused. She was like, but I'm sure that is the new thing we do in the healthcare sector. Why are they refusing? And some human being came into the office and said, it's from the MD, we can't give them blah blah blah. And she goes on to start whispering in the doctor's ear. I guess what she was saying is they cannot release that. That maybe when a patient gets that information, they are not going to come back. Maybe they will go out and buy the medicine and so on and so forth. And because of that, the doctor began to behave funny. Because the guy now said, what about the other medicine we said we could even buy outside? What's the name? So at least we can buy some for her before we get enough money to bring her back. She started saying the dosage I even talked about may not even work for her. It will be like just putting a tiny bit of something in an ocean. You know, she was sounding so empty at that point in time, and I was wondering if she actually knew what she was talking about when she was insisting that every patient has access to their medical situation after each visit to the doctor. You know, please, healthcare practitioners, it is wrong for you to withhold a patient's medical result. They have to have access. It has become their property. You have no reason whatsoever to hinder a patient from having access to their medical records. That is wrong. That is totally wrong and is not done anywhere in the world. Please, we need to improve. We need to improve. It's terrible. It's no longer fun. It's no longer fun. That is just one side of the coin. There are a vast part of the coin that I'm trying to talk about here. You know, I was beginning to wonder even to myself, if that is done to me, how am I going to react? And only God knows that I already know what I'm going to do. Hence, I have experienced it happening to someone else. You don't know the one who that happened to me. Right there in that same clinic, I have gone for some tests that I know that I normally would do. And, alright, I go. I sat down. Oh, yeah, come and take the blood. The human being was insisting she was going to take it here. I said, no, you can't, you mustn't take it here. Come here. I own my body. I have so many veins that is prominent. I decide where. I'm not those people you'll be searching and searching for. See it here. When people even see it, they ask me to come and donate blood. I say, no, I'll never donate blood. It's not part of how I want to be charitable or loving to society. I have my own ways. He said, no, I have to do it. We have seen. I said, no, come here. He's here. Before she came and took it here. Now you open my body. And then you give me one tiny cotton wool and say, put it there. I said, can you please give me plaster or sellotape to cover that spot? He said, no, just sell it there now. Just sell it there now. And before 1 minute, the blood will start. The tray with the cotton wool. Does that make sense? All we have are half-baked lab technicians flying all around. None of them were even wearing lab coats. Just walking around in the lab with their normal clothes. And these same clothes they wear, contaminated or stained with whatever, you take it back to your home. For heaven's sake, a lab is not where you dress in your normal clothes. Every lab attendant or technician or scientist must have on, while on duty, a lab coat. It is for your own good. It shouldn't seem stuffy or too heavy. If you are a true lab assistant or whomever who works in a lab, you will know the importance of a lab coat. No one may tell you. No, you showcase how ignorant you are of your field when you're not properly dressed in your work attire. They run different kinds of tests. People come with different kind of prognosis or whatever. They just run tests and they don't care. you carry the clothes like that home to contaminate your loved ones. That's so crazy. So the human being thinks, and I'm like, no. Can I just get the plaster? Okay, fine, you don't have a plaster. Sellotape, sellotape. Let me seal that place with the cotton wool. No, for them, it's all about the blood will stop. But when the blood stops, that part of the person's body is already exposed to the elements. You can't tell me otherwise. And even if the person refuses, which eventually she will, I'm in a good mood. But I'm gonna start taking it out on anybody if that ever happens again. I will insist on getting a plaster or cotton wool or sellotape. Because hence this part that has been poked by a needle is open. If I come in contact with anything poisonous or something that can get into my body, it definitely will get into my body because that place is open. It's not gonna close until like another 24 hours, a full day. You know, I got thinking about many things, how to explain this thing to these ignorant people. And I said, okay, when I go to talk with a doctor, I'm gonna tell her this. And I told her, like, see what your people did. Is this not supposed to be like this? She said, yes, you know. You come in contact with blood or whatever, that place is open. It cannot reseal under 10 minutes or even 30 minutes. So for those of you who find this video, can you please share it with your brothers and sisters, friends, friends or whomever who work that they are all. It's not saying this and that. Once I see you act in that manner, I put you off. This does not know what he or she is about. You know, so within that past 2 weeks, I was able to go to 2 different healthcare locations. The first one that I'm talking about is a private one, you know, where they wouldn't give people access to their medical records, even though patients ask for it and are paid for it. You have no rights to prevent people from having access to their medical records. Because at the end of the day, they are the ones who are suffering from this situation, not you. So they need to think about and weigh their options, which most of our doctors don't really. You know, I also went to a government clinic. I was even talking to a supposed consultant, which I was happy that, oh, they're taking my file to a consultant. I complained of one, complained of two, and he brushed aside my second complaint. I'm like, so I should just let these other complaints lie low. He said, you know, before he even checked that spot I was complaining about was an issue, of which in the past 1 week before I went, I said, how am I going to even show them this part of my body? He managed to say, okay, let us see. Okay, let us see. You didn't do the proper examination to feel what the person is really troubled about. What sort of consultant are we going to call this one? Or will consultant back or baffle a man for that matter? So what are they actually consulting, dear people, if I may ask? What are they consulting? I thought a consultant should be someone versed in his position and should not default in any way whatsoever. But a consultant is brushing aside the complaint of a patient. It's just so fun. I'm not new to the medical sector. After all, my first degree was in biomedical technology. Even though I've now shifted from that sphere, it doesn't mean that I've lost sight or idea or knowledge about health totally. No. So when I see people doing all of this shift, I begin to wonder where they are actually heading to. The patient explains, you say, no, this is, but this is the patient who has the issue. You are not the one wearing the shoe, neither do you know where it pinches. So it's just so funny. Back to the other private one I went to. They had a doctor, which I said earlier, was just 3 weeks old on the job. A new, fresh doctor, I guess, out of medical school. Which I'm wondering, how do we do our own medical training now? I want to suggest something that the way we have the school of law that law students go to for 1 year is also what we should have for medical students in Nigeria. That after all of your 7 year or 8 year training, you have to go to that program for 1 whole year to brush out your skills and just to be good about what you're about. Because there in the hospital, the doctor who was saying a patient should have access to their record, they can even take a picture of it, and somebody whispers in your ear to say, okay, okay, and then she was telling the patient, hey, I didn't know that. But you just said that the patient has the right. And now somebody whispers in your ear and say, okay, I didn't know. Are you sure of what you're saying? Can you not talk to the medical director about what you said you were taught in school? The director, this is what is obtainable in the system. Not to say, okay, I didn't know. And she tells the patient, I didn't know that that's how they do it. So what do you want the patient to do? You give the patient your word. So won't that person feel, embarrassed that I said something and now I'm saying something else? All they want people to do is to come with trolley loads of money that whatever they tell you, you buy. Whatever they tell you, you buy. Which is something that is also happening in our schools these days. If care is not taken, they will soon start selling clothes and food for the children in schools. They're encouraging parents to give children money to come and buy and buy. What kind of children will we be training who are buying and buying and buying? Right in the middle of children, there is sweet, there is biscuit, there is ice cream, there is this. How would they ever concentrate back to where we were? So I told this doctor also, see what they did, they popped my skin and expected me to just open it, which I know that if I come in contact with something dangerous, it will get into my body because that part is open, whether the blood has stopped or not, it's still open. So how did I even find this doctor sitting in the office in the first place? A young lady, I guess she should be close to her late 30s or something, maybe 26, 27 or thereabouts. How was she sitting? This is a table, this is a chair where she was. She just sat on the table, whether she offloaded her boobs on the table. You know how this kind of meke people would sit? This sort of meke sitting position. The person carries her boobs. Phone is overheating on YouTube. Carry her boobs and put on top table. Then she had this thing there always